Welcome back to The Pulse. I'm Chris Stauffer, and joining us to get the inside scoop on what's happening at Gunderson Health System is the Chief Executive Officer, Dr. Scott Rathgaber. Thanks for coming back your second time here on The Pulse.
Thanks, Chris.
Hey, the questions are not going to change. We're going to keep them pretty much the same, but I'm guessing the answers are going to be tweaked from time to time. So I want to ask you, what's the one big thing you want everyone here at Gunderson to know about?
Well, when we started our journey on the Triple Aim, I was convinced that the key to our success lay in the engagement and the innovation of our staff. Well, I'm happy to report that we've maintained that high engagement of our staff. And we just recently got the results of the medical and associate staff survey, and it shows that there's maintenance of very high engagement from that group. And again, that mirrors the high engagement that we have from the rest of the staff that we get every spring.
Good news and good news.
Absolutely. And what I think is great about that is that as we face the challenges that we always will, I think it's important to have the staff bring their innovative ideas, and you can only do that when they're engaged and around the purpose of the organization. But what is really striking is the very high percentage of people in both surveys that are saying they strongly agree to the statement that they love working for an organization with the purpose that is enrich every life.
Well, having said that, we're always happy to hear, especially in this room, that there's good people here, so that's great to hear. But what's keeping you up at night? What's your concern?
Well, with all the work that we're trying to do with the Triple Aim and the challenges that we face around that, what keeps me up is wondering how we're going to pay for it all. How will we afford all of the things that we want to do? Because one of the Triple Aim points is affordability of care, and we want to bring more affordable care to our patients and their families. And so while we're trying to maintain our quality and our patient experience at high levels, improve the health of our communities, how are we going to do that at a lower cost so we can transfer that affordability back to our patients and their families?
I know one of the things that we talked about before we came on is you said as a leader, you're challenged by some of that too, certainly.
Absolutely, because there's a second thing that keeps me up at night. I don't know if it's fair to go with two, but just last night I was wondering about whether or not I'm keeping consistent in my leadership with the goals that we have in the organization and being true and honoring the servant leadership path that we've aligned. So I want to stay aligned, I want to stay consistent and clear with the messaging as we spread that throughout the organization. And I believe that's a big calling for me, and I look at that frequently to find out if I'm continuing to follow that path.
I think there's plenty of people around the organization who feel that same message, and I'm sure that that's something that you encourage them to try and strive for. Peace of mind. What gives you peace of mind? Maybe the fact that others are striving for those kind of things.
Well, certainly I'm very optimistic that despite the challenges of cost and the things that we have to do in the community, that we're going to succeed. And I know that because of that high engagement level that the staff bring to their jobs every day to strive toward our goals, and that if we tap into that with our purpose of why we exist as an organization, and we all strive toward enriching everyone's life, while we pair that with great data so people can provide action to that, we're going to succeed because we've done it before. We've done it in quality, we've done it in patient experience, and I know that if we can bring that energy together with the right data, that we're going to succeed despite our challenges.
All right. Well, we all like our downtime too, but what kind of things are you watching? What are you reading?
All right, well, I'm two things, I think. One is I'm reading a book called Why Nations Fail. I've always been interested in why countries like Haiti or Afghanistan or Western Africa, why can't they just get it together and be prosperous? And what I'm finding is that a lot of those countries suffer because they don't have the right institutions, the right systems set up, and the right leadership to spread prosperity across the whole country and not just enrich a few individuals. And so what I learned from that is that as leaders, whether it's a nation or it's a organization, we need to make sure that we put together the right systems to support people so that we get the right outcomes. And so that circles back to, are we staying true to what we're trying to do and putting systems and consistent processes in place in order to get the outcomes we're looking for.
Big challenges, but it sounds like a good book and worth the read. You mentioned a show that you're watching, and I was a little surprised to hear this, but it's the show that follows, I think, 60 Minutes on CBS.
That's correct. So it's on regular television, and what we used to call when I was a kid. It's called God Friended Me. Yeah. It's a very interesting series that I've started to record and watch. And it's simply about a gentleman who keeps getting Facebook connections saying, to friends, certain people he doesn't know. Right. And it's sent from someone called God. Mm-hmm. And so he eventually picks up on these folks and then wanders into their lives and finds a way to improve and learn lessons from that. And what I find really interesting about that is that a lot of the things that we come across we don't necessarily control, and it's really our attitude going toward the challenges that we experience, and that we need to embrace those and figure out how to make them better, and sometimes what's the lesson we're supposed to learn when we are facing those challenges.
Have a little trust, to have a little faith. That's a good message, right?
Absolutely.
All right. Dr. Rathgaber, thanks for joining us again for the second time on The Pulse.
Great. Well, thanks for having me.